So one, again, to go back to why I joined Ezekiel Eyes, one of the things that attracted me so much to the practice was that every patient is treated as an individual and you get the time to get to know them. You can ask about their day, what they're doing. And I think part of the reason we're fortunate enough to do that is because we do have a little bit longer that we can spend with the patients. So as far as what we do during a comprehensive eye exam and what it involves, I start by just asking the patient about their day, to be honest with you, before we go into the clinical side of things. But obviously, the first step is to just have a chat with the patient about their concerns, not only their concerns, but also their visual needs. So, what are they actually wanting to get out of the exam? What solution can I offer them? What's their problem? We then take a good history, so any medications, anything like that, systemic history, family history, as that'll also give me a pretty good idea of what's important and how to structure the exam. So the first thing is it just starts with the history. Then what we do is, of course, we do the vision chart, which everyone is familiar with. We have a look at whether or not there's any prescription there. We then have a look at how the eyes are focusing, how's the coordination of the eye muscles, anything like that. Then obviously we do the health. So the health checks the most important part of the eye exam, I would say. So we really, really thoroughly examine the front and back of the eye. So we look at all of the structures that make up the front of the eye. We look at all the structures that make up the back of the eye. And then if there's any concerns or anything untoward coming from that testing, then we might do some extra tests. So we're really, really lucky. We have amazing technology at Ezekiel Eyes, which I'm not sure if you've heard of or not, Paul, but we have this, what's called an OCT machine. We have these retinal photos, which take a photo of the back of the eye. We have these visual field testing equipment. So we have all of this testing equipment, whereas if something's looking not quite right, or we just want to make sure that everything's okay, then we have this equipment available, which is amazing that we can then go on and perform with the patient. It just gives us so much rich information. Again, I think the take-home message is an eye test is so much more than a vision chart. It's almost an art, Paul. I'll keep coming back to that.
And I know it's probably a bit of a cliche, but the window, also the eyes really can be a window into somebody's general health, can't they? I mean, your optometrist can maybe see the first signs of things like hypertension simply by, examining the back of the eye, can't they?
Oh, it's incredible. The eye is one of the only places where you can view naked blood vessels. And because blood vessels obviously run throughout our whole body, if there's issues with these blood vessels going on in the back of our eye, then there's a pretty good chance, and we can infer from that these issues are also going on everywhere else in the body, which is why general practitioners love optometrists so much, is because we can view these blood vessels at the back of the eye and just infer so much information about the patient's general health. So not only high blood pressure, but the other one that we see a lot is diabetes. So sometimes in diabetes, when we image the back of the eye or we have a look with these lenses, we can see sometimes, if it's uncontrolled, these small little bleeds. And what we can infer is that if there's these small little bleeds at the back of the eye going on, then there's a pretty good chance it might be occurring elsewhere in the body. And there's a pretty good motivator to try and get our blood sugar under tighter control. So you can tell so much information just by looking at the back of the eye. Cholesterol issues as well, that also presents with changes at the back of the eye. There's so many different conditions, and there's so much we can infer just from looking at the back of someone's eye. It's a lot more than people would think. It's really amazing. It's really amazing.
And because the human brain is so adaptable, sometimes there are changes happening in your vision which the brain kind of compensates for. And I'm thinking about, things like maybe glaucoma, macular degeneration, even cataracts. So are the kind of tests that you do one way of getting like an objective reading on those conditions before they get, to a very serious extent?
Yeah, absolutely. So, like you said, they're all very objective measurements, which is really good, and they all have a timestamp to them. So, we can then compare future scans to previous scans, and we can see how things are changing over time. You're exactly right, especially with glaucoma, for example. A lot of the time, glaucoma is asymptomatic, and you don't get any symptoms early on. And a lot of the reason for that is because generally the pattern of glaucoma is you start to lose your peripheral vision, but you preserve your central vision. So what happens in a lot of patients is they might be getting this peripheral vision loss, but you don't walk around covering one eye. So you never realize. And the other thing is you're spot on, the other eye compensates for it. So the way we overcome this compensation, of course, we test one eye at a time, but to go back to the equipment is we have something called a visual field machine, for example, which is particularly helpful in glaucoma. Anyone that's done the test will remember it. But basically, you cover one eye at a time, and the patient puts their head in it almost looks like a fishbowl, and they click a button every time they see a light. And because you're isolating each eye, it gives a really, really good idea of what the patient is actually seeing day to day without any compensation from the other eye. So tests such as that are just so handy to get a good idea of what's actually going on. The other thing is, like I touched on briefly, these OCT scans, which basically uses light to produce a cross section of your retina, which is the back of the eye. And we can scan through with such precision and just see all of the different layers that make up the eye that if there is any conditions or disease or anything out of the ordinary, it's just so easy to pick up on these scans. They really have revolutionized eye care. The patient outcomes are just so much better these days because of the precision of this equipment. It's so much easier to diagnose. So we're so lucky, especially again at Ezekiel Eyes. We have amazing equipment. I feel so fortunate to have access to everything that we have access to there.